Welcome to Medicare 360. I'm Jennifer Alfonso Lee, and today we're discussing one of the biggest misconceptions in retirement planning. Many people spend decades paying into Medicare through payroll taxes and assume that when they turn 65, Medicare will cover virtually all of their healthcare expenses. But this is not quite true. Then reality hits. A hospital bill arrives, a dental estimate arrives. That's the biggest thing I see that most seniors need. Um, a hearing aid quote arrives. It gets quite expensive, especially with technology or the latest and greatest. Or a family member suddenly needs long term care. I think out of all of that, this one's probably the hardest and the most expensive. And many seniors discover that Medicare is excellent coverage, but it is not comprehensive coverage. So today's show is called What Medicare Doesn't Cover, the gaps that surprise seniors the most. So today we will discuss long term care, dental, vision, hearing, overseas travel, prescription surprises, caregiver expenses, home modifications, and real life case studies. So let's dive in. So, what Medicare was designed to do? Before we discuss what Medicare doesn't cover, let's understand what Medicare was designed to cover. Original Medicare was created in 1965, and its primary purpose was hospital care, physician services, medical treatments. It was never designed to be an all inclusive retirement health care program, right? Just like our retirement plans right now with our 401ks and Social Security, right? Social Security is not supposed to take over, like be your retirement. You do need other retirement vehicles. I go off on a tangent, except if you had a pension, but pensions are very few nowadays. So, in fact, many of today's biggest retirement expenses didn't even exist in the same way when Medicare was created. Healthcare has definitely evolved. Life expectancy has increased. Technology has improved and costs have risen dramatically. Medicare does help tremendously, but it does leave gaps. So, first, let's go over gap number one, which is long term care. This is perhaps the biggest misconception in America. Oh man, itchy throat. Okay. People often believe if I ever need a nursing home, Medicare will pay for it. Generally speaking, that's not how Medicare works. Medicare covers medically necessary care. It does not generally cover long term custodial care. So, what's the difference? Skilled care, physical therapy, rehabilitation, recovery after surgery. Okay, so that's skilled nursing. Skilled nursing is covered up to 100 days. So keep that in mind. Custodial care, more than likely you've heard about like the six basic living activities and things like that, but custodial care does include bathing, dressing, eating, supervision, and daily assistance. Okay, so the day to day is not covered through Medicare, and that's like the surprising thing, and it's very very costly as well. So, a real life case study: a family calls after mom suffers a stroke. She's discharged from the hospital. The family assumes Medicare will cover ongoing nursing home care. Instead, they do learn Medicare may cover limited skilled rehabilitation, like I mentioned, 100 days, but long term custodial care often becomes a private pay expense. And the family is shocked. Okay. So the teaching point of this is one of the biggest retirement risk isn't hospitalization, it's longevity, right? And everyone wants to live forever now, right? With new technology, um, and new improvements in healthcare. So living longer can be wonderful, but it could also create long-term care needs. Okay. You may have experienced some say, oh, I get care, I get a family member to take care of me. The government pays for it. So there are programs that could be at zero cost to the family or to the senior, the recipient. However, there are qualifications. And usually these qualifications are for like low income, special needs cases. So that's the thing, right? If you are getting a pension or a higher social security than usual, you will definitely not qualify for these programs and will have to pay in your own pocket. And really, just depending on where you are in the nation or the counties that you are in, hire a caregiver could be quite costly, especially if you need long-term 24-hour care. I have clients that have purchased long-term care insurance in the past, and even that may not cover the full amount. So it's definitely something you really want to take in consideration when you are doing your retirement planning to make sure that you have that right. Because as a sandwich generation, we definitely have seen like we don't want to rely on your parents or your children to help you in this. And I think that's that generation we're at right now. So let's go over to gap number two, which is dental coverage. Okay. Even myself, I have not like perfect teeth, meaning I've never had a cavity, or anything like that. And just recently, I had to get a crown and a few fillings, and it was quite expensive. And the crown broke when I was getting it cemented, but that's another story for another day, right? So yeah, definitely as you grow older, of course, it's just wear and tear of your teeth, right? So please keep preventive measures and take care of your teeth because it is definitely important. So many people are surprised to learn that original Medicare generally does not cover routine dental care. Okay, so this means like the cleanings, the fillings, the crowns, the bridges, dentures, and implants. And oh boy, implants are definitely expensive, right? Okay. So, where were we at? Okay. So why does this matter? Dental health affects your nutrition, right? I had a friend that his temporary crown fell off yesterday and he just wasn't able to eat a lot or eat hard food or drink out of a straw. So it does affect your heart health as well, diabetes management, and quality of life. So take those in consideration. So our real life case study, a retired client needs several implants. Okay, estimate 18,000. Oh my gosh. So sometimes people go out of state if it's cheaper, out of the country, nationally, because it's so expensive. So the client says, I've had Medicare for years. I assume this would be covered. Or even if you thought you had coverage, which some plans actually do have coverage, right? It's not going to cover all your implants, depending on your plan. So the teaching point is one dental procedure can cost more than a year's worth of insurance premiums. It is definitely expensive. That's why it's always good to know and review the plan that you have, know what it covers, so you're not quite surprised or off guard that you have to pay thousands of dollars, right? And then there may be other plans or dental coverage that you should get that might be helpful for you as well. Okay, so let's go over to hearing aids. Gap number three. Hearing loss affects millions of seniors. Your Medicare generally does not cover most hearing aids. And this, one day I want to really advocate for this. My husband needs a hearing aid. My son needs a hearing aid. They've had hearing aids in the past, but due to just not really taking care of it, not wearing it, it just either was damaged or lost. And it costs us thousands of dollars to get. And it's just something that we haven't really invested in because if they're not going to wear it, what's the point, right? But I don't think hearing aids is cosmetic at all. So I believe it is medically necessary. So why this is really not covered at the most it should be, just mind boggles me. So definitely why this matters is untreated hearing loss has associated social isolation, depression, increased fall risk, and cognitive decline. So, real life case study, couple discovers they both need hearing aids. Combined estimate is 8,000 to 12,000. The surprise isn't the hearing loss, the surprise is the cost, right? So, it is quite costly. And then, depending if you want it not really seen or visible or just want better technology, that's when it costs a lot. So the teaching point here is many retirement budgets never account for hearing expenses. So definitely, like I mentioned, there are plans that have this covered or a portion of it. So look thoroughly, and if it's something you need, definitely reach out and we could help you out with that as well. So let's talk about vision care, right? Most people do have vision issues. So gap number four. Many people confuse medical eye care with routine vision care. Okay, that's kind of like your optometrist to your ophthalmologist. So, Medicare may cover treatment of certain eye diseases. However, routine eye exams, eyeglasses, contact lenses often have limited coverage. Okay, so real life example, a retiree with progressive prescription changes needs new glasses every couple years. The cost does accumulate over time. There are plans that cover this. There are plans that you could add on or purchase, or you can be a cash patient. So kind of look at that and we can help you go over that. Let's talk about gap number five, which is healthcare outside the United States. Many retirees dream of travel, but here's something many don't realize. Original Medicare generally provides very limited coverage outside the United States. So why this matters? Imagine you're on a cruise, you're visiting Europe, you're exploring Asia, a medical emergency occurs. So now what? So travelers should understand coverage before departure, not during an emergency. Okay, so this is like kind of one of those biggest things. There are two types of Medicare plans, right? So you have your Medicare Advantage plans, and these typically some cover unlimited coverage for emergency and urgent care outside of the United States. You just need to pay pay that, right? Get an itemized bill. And then when you come back, you get reimbursed the full amount. If it's a different language, you might need it transcribed, right? So those are typical Medicare Advantage plans. Some have limits, right? So yearly it does reset. So that's one thing. The other option is if you do have a Medicare supplemental plan. These ones, okay, like you're paying into these plans, but unfortunately, you do have a lifetime max of 50,000. There is a $250 deductible and a 20% coinsurance. So, like I had a client that she had slipped on a boat when she was on a cruise, and the bill was like $200 for like ER or urgent care. So in her case, she had a 250 deductible, right? And 20% coinsurance. So it's just no way to get reimbursed, right? I mean, why get it reimbursed when you do have that deductible? It's just a waste of time. So in that case, she wasn't able to. And then also, like, if you are have the Medicare Advantage plan, what was I going to say? Um, yeah, it just has more coverage when it comes to that. Another caveat though is if you are on Medi-Cal and Medicaid, this you actually don't have coverage. So if you think you have coverage on those plans, like original Medicare, right? Not the supplement, not the one you're paying for, you don't have coverage on it. So keep that in mind. I've had clients that have the Medicare Advantage and easy peasy. They bring the reimbursement form and they complete it and they get reimbursed, which is pretty nice. So let us talk about gap number 6, which is caregiver expenses. So many families become caregivers unexpectedly. Expenses may include transportation, home care assistance, respite care, medical supplies, and lost wages, right? Sometimes we don't think like who's going to take care. And if you're like adamant of taking care of your loved ones, which is very honorable, I mean, you might lose wages, right? If you're working. So keep that in mind. And just the emotional toll that basically being a caregiver has, right? Like, especially if you have someone that has dementia or Alzheimer's, every day can be quite different. They may have good days, they may have bad days, and it's just very, very unfortunate. So this I hold near and dear to my heart because just personally, I've gone through the caregiving cycles, and I mean, fortunately, um, me and my husband were able to help my mother-in-law as well as his other family members. That is a very, very big help, but sometimes things just get so hard for the caregivers that it might not be feasible, right, to live at home anymore or just need more care. So, real life case study is a daughter reduces work hours to help her father. This definitely financially impacts and extends far beyond medical bills, and healthcare does affect entire families, like the sandwich generation, helping further aging parents as well as their own kids. So this one, please think it over with like your siblings if you have elderly parents. What would happen if they need more care? Like, is it a gradual thing, or sometimes it's just not gradual where something happens like a surgery and it just kind of knocks someone off mentally or things like that. So please plan for this, talk to your family, and go over scenarios so it's just not blindsided or it's just not like crazy if it does happen, because it is really tough for families. Okay, so gap number 7 is home modifications. Many seniors wish to age in place. And hey, I don't blame you. I would want to live in my house forever, right? But I live in a 2-story and it might not be the best. I mean, you could get those stairs that electronic gets you up. We sit down and it goes. It's very expensive, and that is definitely not covered. Definitely not covered. Okay, I mean it's expensive. So you got to keep in mind like wheelchair ramps. Even me, like I have stairs going to my house, right? But we have one that has kind of like handicap access. Walk-in showers is a big thing, right? Grab bars, stair lifts. Many are surprised to learn these costs are not often covered by Medicare. But there are plans that may cover something like this. If you're on Medi-Cal and Medicaid, that might be covered more, but just keep in mind that most of the time, and I've noticed that most plans are taking these away, and I think they're taking them away just because they're not being utilized, so why offer it for free? But definitely plan, right? Like we just are remodeling right now. I mean, I guess I'm still a ways away from retirement, but I mean, I guess we didn't sign our house for these things and aging in place, but I guess we'll get around to it. But of course, like if you're in your 60s, maybe it's time to kind of like figure out, like I think my dad and mom has like they remodeled their shower to like in the case they ever needed a wheelchair to go through that, right? Just things like that. Um, so keep those in mind. Home safety expenses are crucial. Very expensive. Like I have step ups in my home. That's like just a bad fall incident, but that's okay. So, um, I would say the bigger lesson, if you do remember one thing from today's show, let it be this. Medicare is outstanding health insurance. Remember, you have that Part A, which is your hospital coverage if you work 10 or more years, 40 quarters, or have a spouse that worked for that. You are paying $0 for that, which is awesome. But keep in mind, you do need some supplemental because going to the hospital could cost you $1,500 for deductible. I mean, over, okay, I'm just estimating for you, 400 for days, what is it, 30 to 60, and then 800 for days 90 plus. So it could get quite expensive. So get supplemental on that. The Part B is that medical portion, your doctors, your MRIs, CAT scans, surgeries. So that is, there's a deductible on that. 80% is covered by Medicare, but there is that 20%. So keep that in mind. That's why you do definitely need to get a plan to cover the gaps. Okay, so either Medicare Advantage or supplement, and that's something we could definitely help you and discuss with you further on that. The purpose of understanding these gaps is not to create fear, right? It is to create preparation for the future. So, you know, most of the time when my senior clients aren't able to take care of their finance, their health care. You know, they go to their adult children, and you know, obviously, as an adult child, you're not even looking at Medicare, so a lot to learn, and definitely you could give us a call, and we could help you learn about it as well. So the families who tend to navigate retirement most successfully aren't necessarily the wealthiest, right? They're often the most informed. And like in my case, obviously I'm an insurance agent, broker, health insurance, Medicare specialist. So like it's easy for me. But I know for the average person, you're not going to read like the 100-page handbook, right? So that's what we're here for. So, families should ask questions, should plan ahead, understand where the gaps may exist, and just really prepare accordingly. I know these um, conversations are tough. People don't want to talk about like the negative and growing older and just these serious conversations, but try to talk to your family about this and your parents and your siblings, just so you're all on the same page, because fights do happen, arguments, and I've just seen the worst of the worst. So hopefully get prepared for this. So I'm Jennifer Alfonso Lee, and this has been Medicare 360. Thank you for spending time with me. Next week, we will go over the Medicare Mistakes Hall of Fame, the most expensive errors we see every year. So until next time, stay informed, stay prepared, and remember, clarity always comes before coverage. You have a wonderful day.